welcome to everyone. It's great to have you here. I really appreciate the turnout. And I know we had some people, because with the weather, they said they were going to be online watching it on the webcast. So hello to all those who are watching it on the webcast. We actually get a count afterwards, so we can see who is sitting in their pajamas at home instead of coming down here. That's okay. We're glad to have everyone here. And given the weather, I just wanted to say certainly our friends and colleagues in Florida and South Georgia are certainly on the top of mind right now, because while we're sitting here with a little bit of rain, they've got some real challenges, and I think they're all certainly in my thoughts and prayers, and hopefully all of us will pull for them over the coming 24 hours or more. So I want to thank all of you for coming. In particular, I'd like to recognize a couple people who are here, and again, Sir John Rice, the chairman of our Woodruff Health Sciences Center board. Appreciate him coming. Pete McTeer, a longtime trustee and board member. Glad to have you here as well. I know Mr. Russ Harden is here on behalf of the Woodruff Foundation, so I was glad he could make it. And I know we have a number of other Emory Healthcare board members. If I go through everyone, we'll run out of time. So I'll leave it there. But everyone, if you're here, really appreciate it. Our deans, our other board members, et cetera. It's great to have you here. This will help. So again, what I wanted to do was to really sit down and talk a little bit about the year that was, fiscal year 2018, and then spend some time talking about where are we going from here. It's a very exciting time in the Woodruff Health Sciences Center's life. It's been an incredible year of accomplishment, of growth, of progress, of impact. And as we move forward, it's been great. In fact, what I did was I asked each of our directors, just for a couple, maybe 3 or 4 accomplishments from the year. And the problem was when they started sending them in to me, it started to get just overwhelming. And I thought, oh my goodness, if I talk about all this, I won't, it's just impossible. So I thought, well, how do we do it? How can I manage all the accomplishments from 18? And I thought, well, you know what, I'll anchor back to a concept that I shared with you first 2 years ago, or actually when I first got here 2.5 years ago. And then I've been bringing back each time when I give this talk and many other talks, because it's really a framework of how I'm looking at the Woodruff Health Sciences Center and the work I need to do in guiding it. And that's really anchoring everything we do to 3 concepts. Pretty simple. Do we know where we're going? Making sure that whatever we do is adding to or following the strategic clarity of the organization. To make sure that we're actually able to execute, that we have an effective architecture that can let us move forward and execute once we know where we're going from the strategy. And I think really equally or almost more importantly is how we get there. Having a constructive culture, having a culture that engages, empowers, and allows all of us to do what we do best, which is hopefully making a difference for the world through our work. So with that framework, I thought, well, let's now look at what's the 2018 and beyond look like. And one of the things of which I'm really proud is the work that clearly falls into that first strategic clarity role, and that's the development of the 5-year Woodruff Health Sciences strategic plan. And this is a plan that was really designed to go on top of the specific strategic plans of each of our schools and centers. Because many of you have spent a lot of time at the school level, at a center level, designing your tactics, your strategies to move forward in your area. And this is really not meant to duplicate anything. It's meant to really layer on top. And then the way it's designed from the beginning was to really start and also then complement and support the Emory University strategic plan, One Emory Engaged for Impact, to make sure that this really directly led and supported that. And there, over about 1.5 years of developing the strategic plan, we had around 250 individuals who are either working on steering committee, on the Woodruff Leadership Council, or in multiple different subject matter expert groups on each of the different areas. And it's been just an incredible process. So if you worked on this in any way, if you were on a subject matter expert or SME team, as we affectionately called them, if you worked in the strategic planning office, if you worked, again, in the steering committee, please stand up. I want everyone to recognize you. So if you worked on it at all, so let's give a round of applause. And that's also a little bit of strategic foreshadowing. For other times, I'm going to ask a few of you to stand up for some particular recognition as well. So what is the strategic plan? Well, we call it collaborate, innovate, and serve as sort of the overall, but it's really built on 5 different themes. And the first of those themes is, again, I felt strongly, and the group agreed, putting it first, is constructive culture. Because creating the environment, creating the culture that empowers, engages, gives the opportunity for people to grow, develop, is really what it's all about if we're going to be successful. And so looking at how we're going to move that forward was the first theme. The second theme is a really exciting one, and that's the interprofessional education and collaborative practice theme. We at the Woodruff Health Sciences Center have a unique configuration. The fact that we have all the health sciences schools, some great centers, we have one of actually the region's largest health system, all under the same organizational umbrella, lets us do things that most other academic medical centers can't do. And that's really to innovate in an interprofessional manner. We'll talk a little bit about that. One of the things that excited me the most about coming down here a couple years ago was the opportunity to really transform models of care. And that's the idea of looking at new ways, innovative ways to deliver care that really could deliver on the quadruple aim, to give better quality, great service to the patients, to do it at lower cost, and importantly, to increase the inherent joy of practice while we're doing that. And the transforming models of care is where we really are looking at and moving that forward. It's obvious we're all about innovative discovery, and the idea of really pursuing interdisciplinary, interprofessional excellence in research is an important part. And all of these, pretty much everything we do nowadays, has an underlying foundation of data science. And we'll talk a little bit more about data science and the importance of it moving forward. Well, you'll see around the health sciences campus over the coming weeks some of these banners. There's a few of them you may have noticed upstairs in the lobby or in the atrium or just outside here. And these really are meant to delineate the collaborate, the innovate, the serve parts of the strategic plan. So let's start with collaborate. And collaborate's an easy one around here because I can say coming to Emory, this is one of the most collaborative organizations I've ever worked in. People really just genuinely want to help each other. They want to make a difference together. And again, people are probably not surprised I have a musical analogy that no one can whistle a symphony. It takes a whole orchestra to play it. And really no one of us, no matter how great we may be at what we do, no one of us is going to be able to make a difference the way that the collective of us, the crowd, can make a difference. Well, starting with the interdisciplinary teams we have, really the advantage of having a great health system with great faculty, great nurses, great staff, great teams that like to work together is really a secret sauce of what can make things work in transforming models of care. And what it's really all about is taking these great teams, building more of these great teams, and then using those as role models for interprofessional education and collaborative practice. Because it doesn't matter if you educate, if people hear something in a classroom, they walk out and they don't see it in real life, it's not going to stick. You want to have people go out and see role models of this kind of interprofessional education and collaborative practice. And in fact, we have a number of really exciting things going on in interprofessional education. I appreciate Linda McCauley, Ira Horowitz running a new interprofessional educational council to help move these programs forward. Just last week, we had our interprofessional education team day, team training day. And we actually had, I believe it was about 1,400 students, medical students, nursing students. For the first time, School of Public Health joined. We had 63 well, we started off with an interactive didactic session for, again, a big group. But then we had 63 preceptors, and I know several of the deans precepted along with a number of other people running 30 small groups that were given interprofessional cases, clinical cases, and really to look at how did each of the different disciplines as students look at the case to show that it was really a much more well-rounded evaluation than simply looking at the medical problem or the nursing challenge or the social issues. So it was really an exciting day. Another interesting and fun project is something called the Interprofessional Student Hotspotting Team. So we've been working with a number of other institutions, Georgia State, social work, pharmacy schools, et cetera, to pull together student teams where, again, a group of students, I think there are around 30 students, work together to do what's called hotspotting. And that's really trying to identify who are those 5% of patients who account for about 50% of medical cost because of their complexity of their disease, because of the challenges with compliance, because of their social determinants. Let's find those 5% and really intervene. And by doing so, it's been shown they can drop the number of emergency room visits, they can drop readmissions when someone that's out of the hospital, but really concentrating on those is important. And the team's been working primarily out of Grady, but it's making a real difference. A number of people on the faculty in the School of Medicine, School of Nursing have been precepting, from Emory have been precepting that team as well. Another program in interprofessional education that's started during the past year and really is ramping up now is the Woodruff Health Educators Academy. And this is an academy looking at educators. And the idea is to support educators across all of the health science schools, not only in their interprofessional education, but in their education within their own specific discipline as well. And they've done a number of things. I know they've worked closely with the School of Nursing and sponsoring a symposium just late last month. Really innovative, exciting work in interprofessional education presented and discussed there. They also have kicked off a WE, as this is pronounced, fellowship. And actually, none of them are here today because their initial kickoff of the fellowship is right now. So they are all sitting somewhere else in a classroom listening to a double AMC expert in educational scholarship, as the role of the fellowship is to really teach and mentor educators to be able to create the scholarship that allows them then to get promoted in the tenure track. So it's an exciting process, and I think there could be a number of other really interesting things coming out of this academy, again, meant to be complementary with the educators' work in the different specific schools. And of course, we wouldn't be schools without students, and student enrollment is something that's been really exciting and interesting to see, really the increasing quality and quantity of students interested in joining us. In the School of Public Health, they enrolled 558 students this year out of a pool of over 2,800 who are interested in coming to the School of Public Health. Interestingly, 43% are people of color and 22% are international. So it's a tremendously diverse group of students. And we see that across the health sciences. In the School of Nursing, again, an incredible year, 899 students enrolled, which, again, that's not including, we're not including the first couple of years who are still in the College of Arts and Sciences. And they have a 42% underrepresented minority percentage. And School of Medicine has continued to grow. When you look at not only the medical students, but also the health professions, over 1,000 students now. There's over 1,300 graduate medical trainees, fellows, and residents. And that school also has been really bringing up both its quality as well as the diversity of its team. This year, almost a third underrepresented minorities in the incoming class. And you can think back 20 years ago, 30 years ago, could anyone have imagined that Emory is really being diverse, inclusive, and so impactful in the state in terms of showing the way? So really proud of what they're doing. It's not just the numbers, but it's really the quality of the students, which is incredible, which is fantastic. A lot of this has been nationally recognized. When you look at, again, I like to say about national rankings, nobody pays attention to them unless it's theirs that are good, right? Otherwise, everyone says, oh, they don't mean anything. But actually, we've got some really good success stories. The School of Nursing has been incredible. The master's program ranked #3 in the country. Interestingly, the Doctor of Nursing practice is ranked #5, and it's only a few years old. It's just unbelievable how well it's been recognized. School of Public Health ranked #7, I believe, and again ranked #5 in NIH funding, if I'm correct. The School of Medicine ranked #23 of the national research intensive medical schools. And again, as our research continues to climb, that's going to continue to really move as well. We also, on the hospitals and the health system, is also a lot of good news around there. For the 7th year in a row, Emory University Hospital has been ranked the #1 hospital in Georgia, and obviously then the #1 hospital in Metro Atlanta. And Emory St. Joseph's Hospital, yet again, was ranked #2 in the state and in the region. So we're very proud of the hospitals. We just got news last week of the Emory Clinic and our physician practices. Vizient, which used to be called EHC, University Health Consortium, Healthcare Consortium, they just started doing an ambulatory practice ranking a few years ago. We were ranked #4 in the country in terms of quality for quality of service by Vizient. So again, incredible work, and national recognition isn't why we do it, but it's nice when people notice what we're doing right. What's really, again, what's impressive is not just sort of the rankings, but it's the people we have. And when you look at the number of people, it gets to be pretty incredible. The university now, this year, has 37,444 people as employees. Of that, about 31,400 are Woodruff Health Sciences Center. So we are a pretty big unit. And again, of that, about 22,000 are Emory Healthcare. That's certainly given us a lot of the people weight. And it's not just the numbers of people, but it's the quality, it's the leadership, it's really the fantastic talent that we've been able to attract as a university, as a faculty, as a staff. That is what's really important. And we brought in a lot of really great new people. Again, we brought in about 4,000 new healthcare employees through the DeKalb Medical merger partnership. And so it's very exciting. So if anyone here, if anyone who joined us within the last year or has a new leadership role within the last year, please stand up. Just I'd like to. So I'd like to welcome all of you. Mike, you should have stood up, Mike. So at any rate, we're really, really excited about that. Another incredible story is what's happening around philanthropy. And that's been just an incredible year's story. It really started with a big bang. And again, the Woodruff Foundation $400 million award was something that's really just unparalleled. It's not only the biggest award in this history of Emory University, but it truly is going to be transformational in what it does through the new Winship Midtown Tower that's being built, or the Health Sciences Research Building 2. Again, we got to think of a better name than that, but we'll work on it. We'll work on it. But that's just a transformational gift, and again, really my incredible gratitude to the foundation and its trustees for that and staff for that. But beyond that, it's been a record year. Again, it's on the order of $658 million for the university, and of that, about $590 million our Woodruff Health Sciences Center, which is really a tremendous record. It kind of blows the other records out of the water. But even if you pull out the $400 million Woodruff gift, it's still, both the university and the Woodruff Health Sciences Center surpassed our goals for the year, even without the gift. So it's just been an unbelievable year. And I like to call them the people formerly known as development. So now again, advancement and alumni relations folks did an incredible job, but so did many of you who are on the faculty, on the staff, otherwise who continued to move forward, and obviously our foundation partners. So if you are a member of AAR, the advancement folks, or if you worked on philanthropy in terms of developing programs, developing proposals, going out and pitching them, I'd like you to stand up. So please, do we have any people from development here? It was an amazing, amazing year. So collaboration is really critical, it's foundational. But let's talk a little bit about innovation, because that's something that, again, we in the health sciences clearly value tremendously and enjoy. And again, when we look at innovating, we know that the researchers we have, the faculty we have in our schools and centers in the health sciences are clearly amongst the smartest in the world. And I think there's no doubt when you look at the quality of the faculty, it's very clear. And in fact, they're not only amongst the smartest, but they're also probably amongst the hardest working. Because when you look at the number of proposals that you all put in over the last year, it's really just incredible. And in fact, if you look at what's happened across the university, there's a $734 million in fiscal year 18 in extramural sponsored research. That's a 17% increase year over year. And in fact, it's the first time we've ever certainly crossed the $700 million mark. Just amazing. Woodruff Health Sciences Center was about $685 million of that. And again, from the Health Sciences Center, we were up $101 million over the prior year. So again, it's just, it has been an incredible ride as we move forward. And the amount of work is not just the work of the faculty and the work of the research staff, it's also the work of our research administration colleagues, people who in the back offices who are trying to push through an incredible volume of proposals as well. We're delighted to welcome Deb Bruner, who's our the inaugural Senior Vice President for Research for the university. And we're really excited to work with her, for David Stevens and our health sciences team, to work with Deb as we look at not only the research strategy moving forward, but also helping her with the moving the research administration to a more effective, more enjoyed part of what we do. So I'd like, for anyone who's been involved in research, if you're a researcher, a research faculty, or part of research administration, again, we couldn't do it without all of you, so please stand up. I want to just recognize the researchers in here. Well, I started off with a segment where I was going to highlight different research projects. And I started looking at the list of research projects, and it went from 3 to 5 to 12 to 18. And I realized that we have so much going on, it was unfair to even try to just capture a couple of them in this part of the talk. So what I really rather want to do is just to acknowledge that we have such unbelievable game changers. I know when I first got here, the quality of our researchers, the quality of the faculty is really incredible. And I'm not sure, for those of you who've been here a long time and haven't had the chance to come in and see what we have and what we've done, it's really remarkable. And what's great is the people who are coming and joining us, the new researchers, are just adding to that tremendously. One of the programs that I was very excited about when I first got here was starting up the Synergy Grant Awards. And as those of you, pretty much everyone in the room probably knows, but for the 3 of you who may not, The Synergy Awards were really a way to try to bring together people across the schools. So people in the different schools and the different centers of the health sciences, bring them together to start projects, to start collaborations where they never had collaborations or never had projects together. And it's been incredibly successful this past year. Working with the Provost's office, we extended it to also include Emory College of Arts and Science, scientists to collaborate with the health sciences. And it's been incredible. We've now given away around $3.2 million in awards to over 90 individual faculty members. And it's been incredibly impactful when you look at the product coming out of these collaborations. You know, the excitement, the spark in science, from my perspective, is at the intersections. You know, it's great to go deep, but when you actually look at the intersections of different aspects of science, you can get some sparks of innovation that are remarkable. So that's really been exciting, and we're looking forward to continuing that program moving forward. Underlying all the science, certainly underlying much of the $685 million of the health science research funding, is data science, is bioinformatics, is biostatistics, and there's a lot going on there. And in fact, as we work move forward the data science components of the strategic plan, we look at what is it going to take to continue to move data science to the next level. Well, we're delighted that Dr. Lance Waller has agreed to direct our data science effort. So we've charged him and a steering committee that's getting pulled together with telling us how do we need to move forward, how do we need to implement the latest data science so that we can take the wealth of data that we have in the health system, in the health sciences, and maybe make it and actually make it accessible to the whole university and to our partners, so we can make it into in a pattern where it can be a resource for the whole to move forward in this area. And I appreciate the tremendous effort. Again, Rich Mendola is here. He's been working real hard on figuring out how do we actually do the technology behind that and move us forward in that way. Well, if all we did was collaborate and innovate, that'd be pretty good. We'd be probably fairly happy. But really, the unique thing that ties everyone in the health sciences together is the opportunity to serve, which is really, it's almost a sacred privilege as health scientists, as physicians, as nurses, as healthcare providers. It's really an incredible opportunity. And that's where a lot of excitement in this past year has come. Whether it's the new EUH hospital tower, again, thanks in large part to the generosity of the Woodruff Foundation. While it officially opened at the end of 2017, it's really been 2018, fiscal year 2018, that's seen it really grow to its full staffing, its growth, its ability to make a difference. And it's not just the national recognition that the cutting edge programs give to Emory University and the health sciences, but it's also the incredible impact that the state-of-the-art care gives to our communities that are important. We also got to inaugurate the Hawks Executive Park Sports Medicine Facility. And this is, as many of you know, really a first in the world facility that's taking not only the sort of state-of-the-art sports practice facility for the basketball team, but it's integrating it with sports medicine, with physical therapy, with personalized performance management and development, with all these things that really never before have been put into one center. And so this was when we did the ribbon cutting. The hint is these huge scissors we're all holding, if you didn't notice that. And the one thing, I've now done a few things with the Hawks, and every time I have to get a picture taken with the Hawks players, they always have me stand in a hole. And I haven't figured out why they make me do that, but I guess I say, okay, I'll step down into that. Another real advance has been the emergence of the Emory plus Children's Pediatric Institute. This again was a couple years of work to get it kicked off, and a lot of hard work and elbow grease in getting the contracting and the agreements and everything done. But it's been incredible. It's a way, really what it's done is taken the relationship where there's been a lot of good work done together, but it's really worked to align that strategic clarity. It's to make sure that we're all aiming in the right direction and aiming in the same direction as we work together to create the academic programs in children's healthcare, whether it's the research program or the educational program, to make sure that we take really best-in-class pediatric and pediatric subspecialty, children's subspecialty faculty and care on the university side and merge it with a really best-in-class healthcare system in Children's Healthcare of Atlanta. So we're very excited. It's really building on the last 5 years of investment by both Emory and CHOA in terms of investing in researchers. And as you know, we've invested quite a bit into the research mission. It's the number 5 ranked pediatrics department in the country. And we're just beginning. This is not the beginning of the end, it's the end of the beginning and the opportunities now that we're really fully aligned moving forward. We've had a couple of other partners you might have heard about during the year. One of those is DeKalb Medical. And again, this was an interesting process. It really started quite a while ago in terms of thinking about the potential partnership. And one thing that's important to say is, again, it's all about strategy. 2.5 years ago, we kicked off our clinical network strategy planning sessions, and we came up with a strategy. And every time an opportunity arose during those last couple of years, we held it up to the filter of the strategy. And when it came to hospitals, and again, in this market, probably every 3 months, a hospital would call and say, hey, are you interested in acquiring us? Are you interested in merging with us? Or are you interested in somehow partnering? And we'd pull it up to the filter and say, nah, maybe not. Yeah, good luck, we're happy, we love you, but not that much, right? But when it came to DeKalb, we held it up to our filter of what is it we want to do in the metro Atlanta area. We said, hey, this matches. And it was a very competitive process. There were, I think, something like 8 or 10 bids when they did a request for proposals. And it was a long process. And to be honest, one of their board members said, I have to say, when it started, it was anybody but Emory, is what they said. Because as you know, we've been competitors a couple miles apart, and sometimes a little tough competition, certainly from their perspective. So really, the team did a great job of reframing that and showing them, no, we actually really we have aligned missions. We have sort of the same communities that we live in, the same benefit. We'd like to bring those communities. So this is adding 627 beds. Again, it's a big system, 24,000 discharges, 130,000 emergency department visits between their 2 hospitals. It's actually a little higher than that this year. Again, over 800 medical staff. Interestingly, the number of people they had in the Atlanta magazine top docs was, I think, second only to ours. It was actually a large number. So these are a lot of really good doctors there, which I didn't know before we started digging into this. So we're very excited about that. And that, again, kicked off officially on September 1st. The other partnership you might have heard about is our Kaiser Permanente partnership. And that's something, again, that conversation started probably 2 years ago now, almost exactly, a little over 2 years ago. And it took a while because it was a very complex, and again, it's the first time they've ever done anything even remotely like this, calling an academic health system their exclusive core hospital providers, and as well as their exclusive subspecialty in almost all other subspecialties. And they're bringing in, again, almost 375,000 insured members. Again, luckily not all of those, luckily for the members, they're not all patients, right? Hopefully some of them are healthy, don't have to see anybody. But actually hopefully for us, there's some that are healthy too. But at any rate, they're bringing in, again, almost 600 physicians, over 200 advanced practice providers. It's very exciting. And so these are both really adding to the excitement, adding to our growth, adding to our opportunity. It was an incredible amount of work for many people, both the design, the negotiation, the planning, And importantly, Kaiser's going to go live October 23rd, so just a couple of weeks. So I know a lot of people have been working in the integration planning for DeKalb, the implementation planning for Kaiser Permanente. So if you have worked on the Pediatric Institute, Kaiser Permanente, or the DeKalb medical integration, or no, please stand up. I just want to recognize, because this is what all of you do. And again, the excitement when we unveiled the signs that there are 3 facilities was just palpable. So again, we've grown a bit. We're now 11 hospitals, over 2,600 beds, 250 locations, 2,800 physicians, again, over 22,000 employees. What's interesting, and I had to actually double check this, was the budget when I got here was a net patient revenue of about $3.06 billion. And this year's FY19 is $4.44 billion. From 16 to 19 in 3 years, about a 45% increase. And that's wonderful and frightening, right? Because now FY19 is going to be taking this and executing. FY18 was full of growth. FY19 is full of execution. And it's not about number. The numbers don't reflect just number. It's not, bigger is not necessarily better, not on its own. But what this does, it begins to get us to our clinical network strategy scale that's necessary to get to our goals, which included making sure we remain a major player in the market, making sure we have the kind of volumes we need to support our research and educational missions, making sure we could support our really top-tier clinical programs that distinguish us as an academic tertiary quaternary center, making sure that we had the funds flow to support our academic mission, and making sure we had the volumes of patients and the concentration of patients to allow us to manage populations well. And with this kind of scale, we're now there. We're really getting close. There may be some more growth necessary to fill in some of those holes. But from a local strategy, it's been pretty impressive. We had already started growing significantly in access points. So here we were as of August 31st of 2018. And if you remember this slide from a year ago or 2 years ago, a lot of these dots are new. And again, those new dots represent access points where we are actually closer to patients so they can come access Emory quality care closer to their homes. So this includes, again, our Minute Clinic and urgent care partners, as well as our offices and PGP offices. Well, when you look at a hole that we had in Gwinnett and DeKalb counties, the DeKalb medical merger helps us fill that in. And that's why strategically, it's one of the reasons why strategically we saw it as such a great fit, because they complement very nicely our service areas. And then when you add in the Kaiser Permanente offices, you can see that we start to really be able to provide care and service, where the patients are, where they need us to be able to have the biggest impact on those communities. So our clinical network strategy had 3 parts. It had a local part, a regional part, and a national and international part. And again, we had a goal of getting to between 750,000 and 1 million unique patients, sort of soup to nuts in our care. And we had about 250,000 to start with. We wanted to get 500,000 to get to the bottom of that. Well, with these 2 mergers, it was a 10-year plan. These between our organic growth and these two projects, we're about 80% of our way towards our 10-year plan of growth. Again, we're going to see an up and then a flattening. We're not going to continue to go up that fast, but again, it's tremendous movement in a challenging market. Our regional market, we talked about more last year, and that's been going great. Again, Don Brunn and his team have done a great job in regional affiliate development. So for FY19, what's our goal? Well, again, it's the rest of the world, right? So we have an international and national strategy, and to be honest, we've been so busy with our regional and our local strategy, we haven't had time to really work on it. Well, we've now got that outlined, we've got the tactics, and we're excited to move forward on that as well. So it's really, having a health system, having a health sciences, it's all about really what are we giving to our communities? What is the impact? If it's like, I don't want to say it's all, we don't want it to be all academic. Because on one hand, we want it to all be academic. But in reality, we want it to have impact. We're just working now on our community benefits report for 2018. So the numbers aren't dry yet. We're still doing some calculations. It looks like we're going to be up to around $90 million of charity care from Emory Healthcare this year. And that's continuing to move up as we grow. And actually, last year, we had about $400 million in total community benefit. We're certainly going to be significantly higher this year once those numbers are complete. So it's really not just about what we do, it's about how we benefit those around us. Well, in terms of how we do what we do, one of the big things is trying to make things better for everyone, make things better for the patients, make things better for our caregivers, providers, faculty, and actually make things work better for the organizations as well. And on the Emory Healthcare side, we're building on the great work that the Kennedy Initiative started in terms of figuring out how do we work smarter, work better, not just work harder all the time. So we took the Kennedy Initiative pilot and we built it out into a whole Emory Healthcare project, which we call Empower, Quest for Excellence. It's because of the word, it's really a lean operating system. And not everyone sort of understands the lean in a process improvement manner. But it's the idea of taking, really every process we do in Emory Healthcare and making sure we're doing it as smart as possible. And it's really a matter of trying to solve 3 goals at the same time. The first goal, the true north, is the idea of giving the best patient care today and tomorrow through quality, cost, access, and compassion. But equally important is the joy of work for the caregivers, for the nurses, the physicians, the faculty, the staff, everyone in the clinical setting. So it's the idea of making sure that people understand they're engaged, they have meaningful work, they have impact, they're empowered to make a difference, they feel supported, there's a culture of respect. All those pieces are really critical. And at the same time, if you get the top 2 of these, in my experience, and I did a similar project in my last job, you end up with better profitability, more flexibility in the markets. You end up with a better organization. So we really started full-fledged in this past year, and we're kicking it off in FY19 across 22,600 employees. We want everyone to understand what is Empower, what are these lean concepts, and how do we empower all of our people to make a difference for our patients. Well, one of the, we know we have probably the biggest healthcare, the most comprehensive healthcare system in the state right now. We also have the best. And how do you define the best? One of the ways is to look at the quality of the care and the compassion. And a great way to look at compassion is to look at what is our nursing doing. And we are proud to be the only system in the state, and really one of very few in the country, with 3 magnet designated hospitals, right? So we've got EUH, and this is the EUH team because they just got redesignated late last month. Emory St. Joseph's Hospital, they also have been redesignated multiple times now, but not long ago. And the first designation for Emory University Orthopedic and Spine Hospital was just a couple of years ago. So 3 hospitals, and it's all about nursing, and it's really the nursing excellence that distinguishes us in the compassion of our care. So if you are a nurse, please stand up and let us recognize you. It makes us all so proud. We have a number of programs. We're really going out to the community and changing the world from their perspectives. One of them is our Emory Healthcare Veterans Program. We just received a $29 million 5-year grant from the Wounded Warrior Project to invest in our program where we're helping more and more veterans with their post-traumatic stress disorder, anxiety, traumatic brain injury, depression, many of the unfortunate sequelae of going to war. It's an exciting project. We're working with 3 other institutions across the country as part of the Wounded Warrior Network. And we're very excited in what we can do to really help those who have given so much of their lives for us. We also, we're really excited about our Marcus Stroke Network and some of the work we're doing there. This is Georgia's first mobile stroke treatment unit. Again, it's run out of Grady, and it is a full treatment unit. It's got a CT scanner, so it goes when this gets to the patient, diagnosis and treatment can start immediately. Those of us in the neurosciences, such as myself, know that time is brain when it comes to stroke. Every minute counts. And to be able to even cut a half hour of travel time off from treatment can make a real difference, life and death, for these patients. So we're really delighted. The Marcus Foundation gave a $15 million grant, 2-year grant, to get us started with this project, and it's going to have a big impact. We just began with this not too many months ago. And then the last of the projects we're going out to the community is actually a School of Nursing HRSA grant, which is going out to look at implementing nurse-driven primary care. And in particular, how do you use primary care nursing, rendered primary care in underrepresented, underserved areas, which can make such a big difference. Well, as Robert Woodruff said, and I've used this quote several times, you continue to grow or you deteriorate. So let's continue to look to the future and what we're going to do. And we're not going to wait for the future comes to us. We're going to change the future. Again, change is the way the future invades our lives, but leadership is the way we invade the future. So we as an organization are going to lead and change that future ourselves. There are a few ways we're going to be doing that. One of them is, again, through the Emory Healthcare Innovation Hub. This is a program that we just started up. It kicked off September 1st. And it's the idea of taking the brain trust of our faculty, of our staff, of Emory Healthcare, taking that know-how, doing what we do well, which is generate ideas, but then provide the support to take those ideas through external partners and through the hub itself to be able to then realize those, move those into the commercial world, find funding, find what we need, in particular looking at digital and technologies for healthcare. And we're delighted that Will Lacey joined us from Duke to direct this program. We also last week just saw the announcement of another new innovator here, and we're really delighted that Mike Cassidy joined us. And Mike, as many of you know, has been the longtime leader of the Georgia Research Alliance, and we're delighted that he's going to come and direct another complementary program, the Emory Biomedical Catalyst. So please join me in welcoming both Will and Mike. And so here's a quiz, the interactive part. So what is the mascot for Emory? Anybody know? An eagle. That's right. Well, almost. It's actually a crane, right? Because when you look at what's going to be going on, it's going to be the Winship Institute Tower at Midtown, the HSRB2, not quite as big cranes, but when you look at the renovations going on at Yerkes, with the McCack Colony, in our different hospitals, St. Joe's and Midtown, and all the building that's been going on, there's always something going on. The backfill, what's going on at Emory University Hospital. It's just incredible where things are going. We're also continuing to build in our foundational sciences, very importantly, things like single-cell genome sequencing, single-cell sequencing, genomic editing, primate genomes. There are a number of areas of foundational sciences where we're continuing to invest, to recruit, and we're delighted that we had Dean Vikas Sukhatme join us, who's got tremendous excitement, innovation, and knowledge about how to be bold in our foundational sciences. And I'm already excited about what we're doing in those areas. The best is yet to come. And then lastly, just want to mention engagement. Engagement is something that many of you know I'm very passionate about. We've really kicked off a big program in Emory Healthcare as well as the clinical faculty, to try to look at survey results, see where are people engaged, where are they not engaged, how can we move them forward. We're also using a really innovative technology approach suggested to us by the WLA class of 18, which you'll be hearing more about, but on how to crowdsource, to take the many, many good ideas from the 32,000 people in the Woodruff Health Sciences Center and be able to sift those down and actually implement. So we talked about the amount of good ideas, the amount of accomplishments, I think I've tried to touch the tip of the iceberg with that. If you want, next year I can do more. So I was thinking about 8 hours. Would that be a good length? Because I'm game if you're in for it. Yeah. So it was just, again, I've only been able to touch the edge, but what's important is that what you're doing in each of these realms, in each of these projects, is really to build the Emory brand. And the power of the Emory brand is really incredible. When we did an Emory Healthcare brand assessment, Emory Healthcare had 3 times the brand score of our next competitor in Metro Atlanta. It's really incredible. It's what all you're doing. It's not just healthcare, but it's also the whole health sciences. And by polishing the brand, again, we're attracting the faculty, the staff, the students, the patients, the donors, the community, the partners, government officials. It's the brand that's important. Every day, what we do needs to polish the brand and continue to increase it. So really, you all are the stars of this presentation. It's what you're doing that really puts us where we are. So with that, I want to just thank all of you for your attention. I want to make sure we have time to get upstairs. It's almost right on time, 3 minutes to go for the reception upstairs. So I hope you'll all join us and have a chance. If you have questions, you can either email me there at EVPHA feedback, or you can just ask me upstairs. And thank you all for your attention. Appreciate it.